The patients that come to the Beeches Green vaccination hub will get a sort of a document describing things like what's contained in the vaccine and what they can expect as side effects, for example. There's lots of information that's available and will be given, and you can always ask you know, on your way into the vaccine centre if you've not seen it or you have specific questions. The one thing I would say about the vaccination centre and the sort of the sharing of information there is, obviously, you know, we're happy to answer you know most questions about the vaccine, but there are some people who are understandably concerned about whether they should have the vaccine in the first place, and I would say the vaccine centre is not a place to make that decision. So that decision really should be either made up with the information that's available via various sources, or in collaboration with your GP. If you've got sort of specific concerns about it and you want a clinical opinion, then collaboration with your GP and getting an opinion on it is entirely reasonable. Most people, you know, have enough information to make that decision. But again, that decision shouldn't be made within the context of the vaccination hub that's really busy and not the best place to be sort of getting that done. So typical reactions to these vaccines are not that different from those that you might expect from a flu vaccine. And most commonly are, you know, tenderness or a sore arm, maybe a little bit red and achy, sometimes joint pains, headache, fever, nausea, fatigue are probably the most common. I think with these recently, I think fatigue has been a huge part of it, and I have also seen a couple of patients that have had diarrhea. So, you know, whether that's potentially associated or not, it's just the pattern that I've observed. The things over and above those side effects from a vaccine that I would be worried about would be a headache that is severe, or that as in it doesn't respond. You take some paracetamol, it doesn't do anything to it, or a headache that is associated with nerve problems, so tingling or weakness, or a headache that is worse when you're bending over or straining. The other thing in particular with this is you're looking out for rashes and sort of pinprick type rashes, and things like shortness of breath, chest pain, swellings. Although that cluster of symptoms is the much rarer symptoms of concern, and I think if anyone had those aside from a vaccine, I'd want them to get in touch with the GP. But in the context of a vaccine, I think, you know, it's just worth saying. But yeah, the distinction usually is most of these milder things will go away within 4 days without any specific treatment, paracetamol if you want to. Most of it's going to be done within 4 days. So if you're going to get a sore arm or a fever or a headache or joint pains, you know, it's going to be take some paracetamol and it will go away. If it's going on a bit more than 4 days, or if it's severe or unusual, particularly in terms of headache and unusual signs that you wouldn't expect from a vaccine, then I would touch base with your GP to go through it. It's been really difficult to predict who would potentially get a reaction or a bad reaction and who wouldn't, and I think, you know, the viewers are going to know that there are people that they know that didn't appear to have any reaction at all. It wasn't even as bad as their flu jab, and then there are people that were floored by it and unable to go to work, and that's probably for both vaccines. I think, you know, that they both have a risk along that spectrum. When it comes to AstraZeneca vaccine, we've been hearing perhaps a little bit more recently, probably in line with the sort of growing concern, not just last week, but prior to that, about side effects being investigated. And although I've not heard about pins and needles, I've not had that in my own clinical practice. People have been pretty poorly with it, and poorly beyond what I would expect from a vaccine normally. So the typical problems that are reported to me are headache and nausea and fever and massive fatigue are probably the most common things that I've heard. And certainly there have been at least a couple of my own patients that this sort of post-vaccination illness has gone on for long enough that I've wanted to get them in and examine them and investigate them to make sure that there wasn't anything amiss. Because I think at the moment we are all learning about coronavirus. I think we're still learning about coronavirus. We're learning about the vaccines. That's very much actively changing. And so I think we need to slightly on the side of caution as we are doing. So the recent issues with the AstraZeneca vaccine that sort of focus on a pretty rare event, which is clotting in the presence of low platelets after receiving the AstraZeneca vaccine, which is a reaction that can happen with other drugs as well, but it is incredibly unusual. I think we're talking numbers in the dozens out of about 20 million people vaccinated over the country. So it's really rare. The issue with it is that the risk of coronavirus goes down with younger populations. So you're talking about relative risk of receiving a vaccine and relative risk of COVID. And these things also change with time and how much COVID is around in the population, and also whether we have new strains and things like that. So it is a movable feast is probably the first thing I would say. The advice that we've received is that if at any age you've had the AstraZeneca vaccine and you remain well, there's no reason why you can't proceed with your second dose. If you're under 30 and you've not had a vaccine, you should be offered a different vaccine. At the moment, that would look like Pfizer or potentially Moderna. We don't quite know about the Moderna. There are also other conditions that would put your risk up, and those conditions are things that are going to make you more likely to clot. So these are sort of conditions that predispose you to clotting, or conditions that you have had since having the AstraZeneca vaccine. So the specific condition, the cerebral venous sinus thrombosis, that we're particularly worried about. So if you've had that, and I don't know of anyone who has had that personally, if you've had that, then you'd automatically be out of having a second dose of AstraZeneca, obviously. But as I said, it is relative risk, and so that's why the younger, more I guess more healthy, or populations with less risk of severe COVID should avoid that. And I think that is the MHRA taking a very sort of risk-averse stance, which is completely reasonable. I really hope the Moderna vaccine will impact the access to vaccines for those in the sort of younger cohorts. At the moment, it's unknown whether we will get delivery of it, and who will be targeted for receipt of that vaccine. So I would imagine, because I know we've heard that people are receiving that vaccine in Wales, that will be rolled out nationally. But the actual supply and any confirmation of supply is pending. So, if there's a clinical reason why you have to have or not have a specific vaccine, then that will be addressed, and via practice searches, you'll be discounted from a certain group and added to another group, for example. But I would be reassured that it doesn't really matter which vaccine. Certainly at the moment, they're all really effective.